Three, two, one. Welcome, everybody. I'm Dr. Chip Whitney, Revolutionary Health Services. I'd like to welcome everybody today to our recorded broadcast for today because I have a special guest. So as most of you know, that I myself experienced COVID-19. I was fortunate and had a fairly mild case of it. And if for those of you who are on Facebook, you want to hear more details of my story, I broadcast it last month. It's on there. But today, I'm actually going to interview a patient of mine who unfortunately ended up in the ICU with COVID-19. And we're going to walk through his experience that he had with COVID-19, because his was much more of what we all tend to worry about with this. So I want to welcome today Scott Wadsworth. So welcome, Scott. Thanks for joining me today.
Well, thanks for having me, Chip. Pleasure.
Yeah, so it's really wonderful talking to you today because, as we'll get to, it was a little bit dicey there for a while. We were all a little bit nervous of where this was going, but to kind of give people some background on it, it was kind of an interesting parallel with the two of us in that we actually got tested for COVID-19 on the exact same day. I was there about 5 or 10 minutes after he was getting tested. And what we're going to find is that just as I was improving in my illness, he was escalating in his illness. And that's kind of the nature about this illness that you're hearing about, is that at about 6 to 8 days, most people either get distinctly better or they get distinctly worse. So let me kind of step back a little bit and go back to the beginning of this. So when he and I both got sick, it was right at the beginning of everything. So we were literally one of the first people tested out of St. Mary Hospital, and probably only about the third day that testing was available. So it was really early on in the process. So he and I had been talking for several days prior to that. So Scott, it was around the 18th of March, we figured that you started having some symptoms. So what happened at the beginning?
Well, at the beginning, it appeared that I was getting a flu-like disease. I had a fever. It wasn't too bad. I started, feeling, fatigued and etc. And that lasted about a day. And then I got better quite quickly, and I felt pretty normal.
Yeah, so that was an interesting part when we were talking, because COVID was on the radar screen at that point. But I was beginning to wonder at the beginning if maybe this was just some other virus, because there were lots of other viruses at the time. It was the end of winter. And so there was way more than COVID out there. And we'd been hearing already at that point that only about 12% of people who were tested for COVID were turning out positive. So there were lots of other viruses. So I do remember you had a little bit of a cough with it also. And I think your fever wasn't too bad at the beginning. It was like, I think if I remember, at 100 or so at the beginning, but you had little body aches, et cetera, at the beginning. So we were kind of in contact through the time. And then about 4 days into it or so, something changed. What ended up happening about 4 days into it? Actually, the day that I first started my symptoms. So he had his symptoms a few days before I did. And then we both literally on my birthday, March 21st, we both started getting symptoms. So what did you notice at that point, Scott? What changed?
Well, the fever came back. The fatigue started coming back again. And then probably a day after that, really started to get a higher fever. I had chills. The shakes I couldn't get rid of. I felt cold all the time, or I felt burning up. So it really became much more persistent, and it just kept getting worse for the next 2 days.
He had real fevers. I mean, he was getting 102, 103. I think he even had a 104 in there somewhere within that fever, body aches, chills, just taking Tylenol for it. But at this era, and still as we are now, that we wanted to try to keep people out of the hospital if we could. And so, but he wasn't having any short of breath. So he was having these really high fevers, but he wasn't having any shortness of breath. On a daily basis, I was asking him about the shortness of breath. And so his fever started on March 21st. By by the 23rd, we got him tested because he was having these fevers. And then on the 24th is when he started just shortness of breath. So I spoke to his wife the next morning on the 25th, and it was like the morning of the 24th, he wasn't having any significant shortness of breath. And then by the next morning, I'm talking to him and it had escalated significantly. So kind of walk us through that 24 hours of when you started developing shortness of breath.
Right. And I had had a fever at that point of a little over 104 for at least a day, maybe longer than that. And I don't remember everything perfectly. I actually have to rely on my wife for that, because I think that sort of confusion and haziness, mental haziness, is also part of the disease. But I do remember that the evening of the 24th, or later at night, I was really short of breath, gasping for air pretty much. And then I got better. And that did not persist. I mean, I would not have shortness of breath just sitting around or laying down. So we decided against going to the hospital that night. And then the next morning is when we called to talk to you again and explained all of this. And that's when I went into the hospital.
Right. That's when I started getting really concerned, because he hadn't had any shortness of breath. He mentioned the mental confusion, and that could have been the virus itself, but that also could have been the lack of oxygen. Because one thing people should know about during this time is that we really didn't know at that point how much people would have really bad oxygen levels, despite not having that much shortness of breath. I mean, I've heard of people having an oxygen level that's like you're not getting any oxygen in your blood, and not really having that much air hunger. It's not an asthmatic type of condition. My daughter, who has asthma, she got the flu in February, and she got hit hard with her asthma at that point. But when she had COVID in March, the week before I did, that she really didn't get short of breath at all with it through her entire course. So it really wasn't causing that much shortness. When he told me he had shortness of breath, I was like, sorry, Scott, you got to get to the emergency room. So he did. He went to the emergency room, and it was just kind of clinically, they did some testing. They did a chest x-ray, and the chest x-ray showed a little bit of a pneumonia. It showed one lung at the bottom section of it, showed a little bit of a pneumonia, not all that bad. And so they did admit him to the hospital to watch him. So that was on March 25th, he was admitted to the hospital. And then tell us, Scott, what they were starting to talk to you about the next morning.
The next morning, they wanted to send me home.
Yeah, they wanted a little oxygen, and because they were really trying to keep people out of the hospital at that point of time. This is no fault of them, but they were looking to send him home, not realizing what could end up happening. Again, this is really early on, and there weren't many cases in the hospital in Bucks County at that time. So what ended up happening through your day on the day of the 26th?
Well, I had another chest x-ray done, and I didn't realize at the time until I talked to you later that it showed a pretty severe escalation in the pneumonia.
Yeah, it did. So basically, what happened was that they were talking about sending you home in the morning, and the next thing you knew, what were they telling you after they got the chest x-ray?
That I was being moved to the ICU, which they said was just so they could better monitor me. So I think that it was
They're
just
being kind and gentle to you, not
exactly
to scare you, because when I took a look at that chest x-ray that he had done, he went from a little bit of a pneumonia on one side at the bottom to what we call a whiteout on both sides. Both lungs were filling rapidly with fluid. So he, without question, was undergoing this cytokine storm that you hear about, where his immune system was going crazy, and it was a raging inflammation in his lungs, and he had so he was getting increasingly worse on the oxygen. So they really needed to have him there, because they were actually, I'm sure, concerned about him needing to be intubated. Because it gave me a whole new awareness when I saw that as to how rapidly this disease can escalate. So anybody out there who gets this condition, I really want you, if you start getting some shortness of breath, that's the time to act. Not any, don't let it linger too long. So you went to the ICU, and I got a call from the ICU doctor saying that I really think this is the real deal, that this is looking like COVID. We didn't have, unfortunately, the virus test back. So we were both tested on Monday morning, and this was, I believe, Thursday or Friday, and we didn't get your result till Friday. So so when you went to the ICU, we still didn't have any results of your COVID test, but the ICU doctor was pretty sure that this was COVID. So what did they do for you at that point, treatment wise?
Just up the oxygen a little bit for me, but the main thing was that I was given hydroxychloroquine.
Yeah, he was given hydroxychloroquine. So here's this guy who for several days had been having 102 to 10 up to 104 fever, so that going into the day that he was admitted to the hospital, had initiated his cytokine storm. So he was he was going a bad direction very quickly, and he was given hydroxychloroquine on the 26th. And literally within a day and a half, his fever broke. I mean, within 24 to 36 hours, right, Scott? Your fever broke, and you were really not having a lot of shortness of breath during this time, correct?
That's correct. Yeah, and it was about a day and a half later that the fever broke.
Yeah, so I mean, it was amazing to me. I mean, we now heard a lot of really good stories coming out of New York and other places about how many people this is turning around amazingly well. And Scott was one of them. And I'm absolutely convinced, Scott, that if you had not gotten hydroxychloroquine, you were on the rapid path to needing to get intubated. I'm happy to tell everybody that he did not need to get intubated. And literally, I think it was about 4 days after the hydroxychloroquine, 4 or 5 days, you got discharged to home, and you started your recovery there. So yeah, so that was a bit of a hairy situation there for a few days. So what did it feel? I want to get into now. How did you feel in there? Because your wife was actually. Can we bring your wife Lisa into the discussion now?
Sure, she's just walking over here, but it was a very surreal experience.
She wasn't there. I know that they said that. So actually, Lisa, hi everyone. This is Lisa, Scott's wife. And so Lisa, tell me, when you dropped Scott off at the hospital, what did they say and what did they do?
Well, they came up. I knew ahead of time that I was not going to be allowed in, but it didn't hit me until they actually took him from the car. Really didn't speak to me. They took his temperature, took him out of the car, and waved me away. So not even, we'll take care of him, say goodbye. It was just go away, get away from us. And I drove away just, well, let's hope that, I didn't know what to think. It was like Scott said, surreal.
So literally, and that's I don't want to let people think this is an uncaring hospital. It's like, no,
Yeah.
He was in isolation. I'd already called them that morning telling him he was coming, and I was pretty sure he had COVID. So that immediately they didn't want her there, figuring that she might be contagious, and they really had to keep isolation together. And I'll tell you, this was Doylestown Hospital, and I am very impressed because I actually did antibody testing on an ER doctor from up there, and who, after seeing many patients there, turned out antibody negative. So they really have to commend them on their infection control efforts, that they were very successful at doing that. So, but anyway, so you didn't get to see Scott for what, a week? Over a week?
8 days.
8 days worth. So Scott was literally, let me set the scene here. When people are in the hospital with COVID, you're in isolation. So you're in the room by yourself. And basically, when people walk in to take care of you, they're wearing basically spacesuits, right, Scott? I mean, they were wearing gowns, they were wearing masks and gloves. And so it was almost like there were space creatures coming in to see you. You didn't get to really see much human beings, correct?
That's right. They had face shields, etc., and they had a pretty extensive program for how to deal with their PPE. And I also want to take this time to say that I was very, very impressed with the care that I got there. The nurses were unbelievable. And the ICU doctor was fantastic. I just think it was
He,
handled really, really well.
he really was. Dr. Archaya, I will tell you that his name right now, he was great because he called me up when you were going to the ICU. He hadn't even seen you yet, but he was pretty sure you had it all. So he wanted to get some details from me. He kept me posted throughout the time. And then he actually, once we started discovering that there was blood clotting with COVID-19, he actually reached out to me, Scott had been long discharged by then, and he wanted me to make sure that he was on blood thinners because people with COVID-19 were at risk of blood clots like heart attack, strokes, and other things for a period of time after having COVID-19. So he actually reached out. So I was very impressed with their care also. So what did you feel like being isolated in the hospital like that? Was it scary? Were you just kind of, how did you feel going through it?
Well, it was kind of not what I expected. I thought I would be a lot more worried than I was. There was this sort of sense that, well, I'm doing what I'm supposed to be doing. I was doing some exercises that they recommended to help clear my lungs, and anything else I was told I was doing. So I said, well, I'm doing what I can. And we'll just have to sit here and wait and see what happens.
This is a classic example where I've seen so many times over here when the person who's going through the health crisis, it's kind of, there's a sense of peace that's within them that and honestly, the person who gets impacted the most emotionally is the spouse. So Lisa, because it's a scary time, and tell us how you felt through this time.
Well, I have to thank the ICU doctor. He called me every day and let me know how Scott was doing. It wasn't always a pleasant conversation. Cautiously optimistic was the word from both you and the ICU doctor, but at least he called me and let me know what was really going on, because Scott, as he may say, he was not too worried. He was certainly not his normal self. He was lethargic, and at first he wouldn't FaceTime me because he didn't want me to see him on oxygen and all the rest, and I couldn't wait for him. It took the second day till he'd FaceTime me, and then that helped a great deal just to be able to see him. And I could, as the days went on, I could see that he looked better. But for me,
you were sick too?
yeah, I thought I would be my normal type A worrywart, walking around the house in circles, but I just was totally fatigued, slept 12, 15 hours, and I started to think, well, I'm sleeping to avoid my feelings of concern. And actually, I had a reason to be fatigued, because the day before he got out of the hospital, I was tested, and 3 days later, we found out that I too was positive.
Not surprising. So it's
draining on both ends.
Fortunately, you and I were wonderfully boring with our COVID, that we had kind of the usual case of it. I mean, what is it, like 75, 80% hardly getting any symptoms from it all. We had more of the usual cases. I think mine was actually a little bit worse than yours. So not surprising at all that you got it, but fortunately you did, you're better. And I will be happy to report that we did antibody testing on both of them. And I have to say, well, Lisa and I were both significantly positive. With the finger stick that we were doing at that time, as you'll see in the past recording that I did, we do blood testing now because it's more accurate. But we did the finger testing, and Scott's was really rather funny, I have to say. His lit up like a neon light. I mean, it was like almost instant. You have to wait up to 13 minutes or 15 minutes to consider it negative. And mine and Lisa's both reacted pretty quickly. It was kind of a no doubter within 2 or 3 minutes. But Scott's, it was like almost immediate that his turned out positive for it. So he had a wonderful immune response that is arguably now protecting him now. So Scott, how are you feeling now? So now we are, what, about 6 weeks out? No, actually, we're pushing 2 months out. We're about 8 weeks out of it. So where are you now? Do you have any lingering symptoms? Because we're hearing a lot of people who had the pneumonia aspect of it, having some lingering respiratory symptoms. What do you have?
Well, I have a lingering cough. My energy level is pretty normal, maybe just a tad below what it usually is. I've been back working from home for 2.5 weeks, and I've felt pretty good.
Great. Well, I'll tell you, everybody, this is, unfortunately, in the news and everything, that there's been a lot of, and still don't understand why, bad mouthing of hydroxychloroquine. I mean, in terms of the who should use it, who shouldn't use it, and I'm not going to get in any of that junk, but I will tell you, this man here, I'm sure it helped him dramatically. I'm sure, given how bad he had gotten, he'd be worse today if he didn't have it. And I'm going to add the added bonus to it is that that you actually have some heart arrhythmia issues that we had to be a little bit careful on doing it. They actually didn't want to give you the Zithromax combined with it because of that, but they felt that it was safe to the hydroxychloroquine, and you did just fine through it. So it's they watched your EKG and you were fine. So even as someone who might have been at risk for one of those cardiac complications you have, that he didn't. So not to say that we shouldn't be cautious about that when we are going to be using it. We need to do that and use it respectfully and watch for things, but it's just, I don't want people to be afraid of it if they start hearing the use of it more. And fortunately, over the course of time, these studies that are ongoing are going to figure out which best combinations are there, whether it's the remdesivir, which got approved, hydroxychloroquine, and but Scott's worked so well. And I mean, the ideal combination is hydroxychloroquine, azithromycin, and zinc. And I'm pretty sure that he didn't get zinc at that time because I don't think we were recognizing the value of zinc in combination with hydroxychloroquine. So, but anyway, so that's anything else either you wanted to add that we have not discussed here?
I want to thank you, Dr. Whitney, for helping me through this as much as you helped Scott. You really listened to me. You put me in charge of watching his symptoms, and I did that. And together we got him to the hospital when we needed to. And then you too called me every day, more than once a day, to help me through it. And I'll be forever grateful.
No, my pleasure. It's what we do, and it's just it's a scary time. Like I said, it's the loved one sometimes through health crises, and whenever anybody's going through a health crisis, don't forget about the family members. So help support the family members, because it's more often than not that, yeah, we always think about the person going through the crisis, but the family members get forgotten, and psychologically, because they feel helpless. They feel like they can't do anything. I mean, Lisa was literally not even able to hold his hand or comfort him anything other than Facebook or FaceTime.
Right.
And that's a really stressful thing for the family members. So yeah, don't forget about the family members when someone's going through stress. So I want to thank you both for this conversation. I think it's been great. I think it's going to be very helpful for people to understand what it really is like to go through a health crisis, and that it was and in the end, this was a success story. It was it did not go a bad direction. I'm really happy for it. And all right, so I'm going to end that now, and I hope everybody has a great weekend and enjoy time. And if you want to learn how you can prevent getting COVID-19 when we start opening up the country and the state, and if you do get symptoms, what you can do, I would think about it, go to my website, rhslivewell.com. I have 2 articles that I posted about surviving COVID-19 when we do come out of our hibernation. One is an explanation of inflammation, what happens. The other is more of a practical to-do list of ways that you can help to prevent yourself, to tune up your immune system maximally, so that when you start getting out into society again, you don't have to succumb to this illness. All right, so have a great day, everybody.
Thanks very much.
Thank you.